Hi, this is Dr. Deneen Grace, PhD, founder of the Cancer Detox. I'm a scientist, author, as well as chief prevention officer here at the Cancer Detox, where our motto is prevent today, thrive tomorrow. This is all about empowering cancer preventers, cancer patients, as well as cancer survivors with the clarity, tools, and support to reduce the risk and take control of their health starting today. This is all focused in on science backed, heart centered, personalized cancer prevention that we feel all people need. So, our health coaching programs are focused in on exactly that. Thank you so much for joining today's webinar. This one is going to be focused in on a recent question that I received at a health event, and it's focused in on how to prevent a recurring breast cancer. So I hope you find it helpful. Let's go ahead and dig right into the information. Welcome to today's webinar. We're going to be focusing in on one of the more recent questions that I've been getting, especially at my in-person events. I was recently at one, last week, focusing on women's empowerment. It was the New York Black MBA Society Women's Conference, and it was focusing on the power of you. And a phenomenal group of women were there. One thing that I got asked the most frequently after my panel discussion was, how can I lower my risk of a breast cancer recurrence? This was something that a lot of the attendees were dealing with as well. Even some of the vendors, there were quite a few ladies there who were vendors who were discussing their breast cancer journey, their treatment journey, and how they can lower their risk. So this particular webinar, we're going to focus in on that. And so I want to bring up the fact that in the US, really, there's an ever-growing number of breast cancer cases as well as breast cancer survivors. As treatments become much better, we know that breast cancer patients are surviving longer and longer. So right now, there's well over 4 million breast cancer survivors in the US. And that includes those who are not only survive the actual treatment or have their treatment that was ended, those are also people who are actively being treated. So we know that the focus of the healthcare system really is now trying to help breast cancer survivors thrive after their treatment has ended. And part of that assistance that the healthcare system should be providing is ensuring that patients know as much as possible in preventing a second breast cancer diagnosis. What we do know is that lifestyle does matter, and it matters quite significantly, because about 25% of women diagnosed with early stage breast cancer will eventually go on to potentially succumb to the disease later due to metastasis. And lifestyle choices can influence outcomes. And when we know better, we do better, right? So lowering the risk of a recurrence or possibly death with appropriate lifestyle choices is one reason why these discussions need to be had with your healthcare provider if you are a breast cancer survivor or even a breast cancer patient. So some of these topics that I'll be discussing here are really for educational purposes only. This is not intended to diagnose or treat any specific type of disease. This is just essentially education that is coming from the medical literature on some of the more recent information about breast cancer survivors and their lifestyle. Many of the clients that we work with in our health coaching program, they come to us because they want to make a health transformation after their diagnosis. So whether that includes trying to eat more plant-based foods or becoming more physically active, they want to be held accountable. They want to have a coach. They want to have somebody that's holding their hand as they navigate life after their breast cancer treatment and diagnosis. So one thing we know that what breast cancer really does not like is really somebody, a woman, a person who is actively engaged in physical activity. And this is moderate to vigorous types of activities. And again, this is not used to diagnose or treat any particular type of disease. It's just showing what the actual medical literature has published. So if you are a breast cancer survivor, you want to have this type of conversation with your physician, you want to start asking them what type of physical activity that you can be doing. In my point of view, this is kind of the number one question that breast cancer survivors should be asking. What am I approved to do? What am I able to do as a breast cancer survivor? And really engaging and having a two-way conversation with your healthcare provider. That's my particular point of view as a scientist as well as a health coach. We know that diet alone for breast cancer survivors, really the data has been kind of sparse, I should say, when it comes to reducing the recurrence of breast cancer in this particular population. It is part of a healthy habit, though, to look to increase the amount of vegetables in your diet. And there is some convincing evidence. However, it is not a silver bullet. And I do want to preface that and make sure people do know that it's important, that diet is important. However, it's not a silver bullet. So we know also that with breast cancer survivors that report only getting less than about 9 metabolic equivalents per week of exercise. That equals to about 30 minutes of walking on a daily basis. And also, only half of breast cancer survivors say that they eat at least 5 daily servings of vegetables and fruits a day. Clearly, coming out of breast cancer treatment is can be quite difficult for a lot of survivors, and making sure that they kind of stay on track will require some additional input from the healthcare system to try to help them navigate life after that and also get on track with some of the more healthier habits. Some of the strongest evidence for breast cancer survivors to answer the original question is that exercise does provide the strongest level of evidence. And we know that at least 30 minutes of moderate exercise a day, 5 days a week, or 75 minutes of vigorous exercise per week does seem to have an impact on the outcomes of breast cancer survivors. There's a recent study that researchers did where they looked at just under 1,500 women who were had an average age of 50 years old, and they were diagnosed with early stage breast cancer. They wanted them to look at how vegetables, fruits, and exercise affected their risk of death after beating their initial breast cancer diagnosis. The patients in this study, about 30% of them were stage 1 breast cancer survivors, another 45% were stage 2, and 15% were stage 3. The majority of patients were taking tamoxifen, and all were cancer-free as determined by an oncologist prior to entering the study. The women in the study were within 4 years of their breast cancer diagnosis, with an average time from diagnosis to the study analysis being about 8.7 years. And the women were asked to provide the amount of vegetables and fruits they ate over several weeks. As well, they gathered the amount of physical activities they did, with 3 metabolic equivalent of tasks being mild activity, 5 METs being moderate, and 8 METs being vigorous. What the researchers found was that women who had a high vegetable and fruit intake and also had a high physical activity intake had a 10-year survival rate of 93%. And that 10-year survival rate was lower, 86 and 87% respectively, for women who ate a low vegetable and fruit per day and did high physical activity, and 2, ate high vegetables and fruit per day, however, had low physical activity per day. So we know that the combination of eating vegetables and fruit at a high rate, as well as doing high physical activity every day, seemed to reduce the mortality rate in women who were normal weight as well as obese in this particular study. So this is truly a significant finding. And science has shown that women who are obese have an increased risk of both new and recurring breast cancer diagnoses. So definitely take note of that if you're a woman who does fall into the category of being overweight or obese, that this particular combination of vegetables and fruit per day, as well as high physical activity, does seem to help reduce the mortality rate in women who are breast cancer survivors. So the researchers actually teased out quite a few more results. And what they found was that eating just vegetables and fruit and its effect on the risk of death, they found that the more vegetables the woman ate, the lower the mortality rate. So women who ate less than 3.4 servings of fruits and vegetables daily had the highest mortality rate of 12.4%. And the more vegetables and fruit women ate, the more decline the researchers saw in the mortality rates. So the effect was seen up to women who ate up to 5 servings of vegetables and fruits a day. This particular effect was seen across different types of breast cancers. So, estrogen receptor positive, progesterone receptor positive women, those women also had significantly increased survival rates compared to women who ate low vegetables and fruits per day. As well as low levels of physical activity. So, this trend seemed to be seen across different types of breast cancers. The one caveat I will say is estrogen receptor negative and progesterone receptor negative breast cancer survivors did not see a significant increase in survivorship, though there was a numerical increase in survivorship for women in the high vegetable and fruit category who also had high levels of physical activity. And that was about 10%. My point of view, again, as a woman who is a breast cancer survivor out there, and you're having questions about whether or not this will have a significant impact on your rate of survivorship, definitely I will link the article in the description below so that you can pull it up, have a conversation with your doctor about it, and see what's right for you in terms of your diet. And I do also want to say that another question that breast cancer survivors should be asking is whether or not they should be meeting with a nutritionist that can help tease out some of this information and help them focus in on the appropriate nutritional and dietary levels that they need in order to lower their risk of a breast cancer recurrence. As well, speak to your healthcare provider about the type of physical activity that you can be doing that can fall into this 5 METs or 8 METs per day category, which show to have an impact in the lives of breast cancer survivors. So, with that being said, this is one type of thing that the Cancer Detox does to increase the awareness for breast cancer survivors. Of course, I have this information in my book, Cancer Prevention, the Diet and Lifestyle Habits That Cancer Hates. And I also focus in quite a lot on breast cancer survivorship in the book with a section focused specifically for breast cancer survivors so that they know what's important for them to reduce their risk of a breast cancer recurrence. Everything is based on what's been published in the medical literature. So I'm very keen on that. As a scientist myself, I want to make sure that people understand what's going on. So with that, hopefully this information is helpful to you. I will put a link in the description about the book. I will also put a link in the description on how you can get in contact with me to have a conversation about some of the more important questions that breast cancer survivors should be having with their doctors around their survivorship. Definitely will include a link for those who meet with me. I have opportunities to meet on my calendar, so I'll drop a link in the description on that as well. Hopefully, this has been very helpful for you. And until next time, thank you so much for watching, and we'll see you then.